Hi everyone, welcome to my channel. In this video, I will be talking about osteoarthritis. If you found this video helpful, please give it a like, and if you want to see more content, please consider subscribing to my channel. So osteoarthritis is a progressive degenerative joint disease that involves destruction of cartilage as a result of repeated stress. It's important to note that this disease is both asymmetrical and non-inflammatory, which is a distinguishing factor between rheumatoid arthritis and osteoarthritis. Part A shows normal cartilage in the joint space. However, as the joint experiences repetitive stress over time, the joint space starts to narrow due to the erosion of the cartilage, illustrated in Part B. As the joint experiences further mechanical stress, bone spurs will start to form, which are called osteophytes, as illustrated in Part C of the diagram. So this chart further highlights the different causes of osteoarthritis. Obesity is a great contributing factor that leads to osteoarthritis, as it places more load on the weight-bearing joints such as the knees, spine, hands, and hips, thus leading to greater cartilage destruction with mechanical stress. One's occupation can also be a factor that leads to osteoarthritis. Such occupations tend to involve a lot of repetitive movements that place a lot of stress on weight-bearing joints, such as jobs in healthcare. So with clinical manifestations, obviously you would see joint pain with the use of a specific joint. It's also important to note that pain usually occurs as the barometric pressure falls as a result of weather changes. For example, people tend to experience joint pain when flying due to the high altitude and thus low barometric pressure. People with osteoarthritis can also experience loss of function and mobility as a result of pain and deformity. In contrast to rheumatoid arthritis, osteoarthritis will have no inflammatory signs and symptoms such as any fevers and will be asymmetrical in its manifestations. Patients with osteoarthritis will experience morning stiffness that usually resolves within 30 minutes, which is another important distinguishing factor between osteoarthritis and rheumatoid arthritis. A crackling or grating noise upon movement of the joint, which is called crepitus, is also apparent with osteoarthritis due to the lack of cartilage within the joint space between bones. Two particular deformities are apparent in the hands with osteoarthritis, which are Bouchard's and Herbedine's nodes. In Bouchard's nodes, the proximal interphalangeal joints of the hands are affected, whereas in Herbedine's nodes, the distal interphalangeal joints are affected. Bouchard and Herbedine's nodes are shown in the illustration of the hand. With diagnostic studies, CT scans, bone scans, and MRIs are ordered to determine the extent of osteoarthritis. X-rays are ordered, which would reveal narrow joint spaces in the affected areas as a result of cartilage destruction. X-rays can show osteophyte formation as well. It's important to know that the extent of apparent bone deformity does not always correlate with a patient's pain level. For example, a patient could vocalize severe pain with minimal deformity apparent on an X-ray and vice versa. A synovial fluid analysis can also be used to differentiate osteoarthritis from other inflammatory arthritises. The medical and nursing management of osteoarthritis revolve around patient teaching, medication administration, and other surgical interventions. In patients with osteoarthritis, teach patients to implement non-weight-bearing exercises such as walking or cycling. Such exercises can assist with weight loss, which places less stress on weight-bearing joints. Other weight-bearing exercises such as running or jogging should be avoided, as this may exacerbate pain and deformity with osteoarthritis. Also teach patients to implement adequate rest periods and immobilize the extremity as needed to decrease pain and conserve energy. Physical therapy can also be used to restore mobility and function of the affected joints, as well as reinforcing good body mechanics to prevent risk for falls and injury. Alternative therapies such as yoga and Tai Chi may also be beneficial for someone with osteoarthritis, as they can further facilitate function and mobility. Medications such as Tylenol, topical creams, and NSAIDs are administered to ultimately treat pain associated with osteoarthritis, which we will discuss in the next section. Surgical interventions are typically reversed after more conservative interventions have been ineffective in either managing pain, preventing deformity, or facilitating independence. A knee arthroscopy is a procedure that removes loose cartilage and debris from the joint cavity, which aids in relieving pain and restoring function and movement. However, when all other interventions and procedures have been ineffective, patients will typically need more invasive surgeries like a partial or total knee replacement. This chart illustrates the types of medications and procedures used to manage osteoarthritis. For patients experiencing mild to moderate pain, Tylenol is often prescribed, or topical creams such as capsaicin cream or Voltaren gel. These medications can be taken concurrently, though either medication may suffice in managing the pain. It's important to note not to exceed more than 4 grams of Tylenol in a span of 24 hours. When Tylenol and topical creams are ineffective, NSAIDs like ibuprofen are prescribed, but it's important to monitor patients for side effects related to the GI system. NSAIDs should not be given with aspirin, as NSAIDs affect platelet aggregation, prolonging bleeding time, which puts patients at risk for bleeding. Corticosteroid injections and COX2 inhibitors like Celebrex are used when other initial medications are ineffective. Hyaluronic acid may also be administered, as they can support the integrity of cartilage, thus alleviating pain. And that is it for the video. If you found this video helpful, please give it a like, and again, please consider subscribing to my channel for more content.